Time for our injury report on the Pat and Aaron Show, presented by Florida Orthopaedic Institute in partnership with Tampa General Hospital. And joining us now, Dr. Jeffrey Kannen. Good morning, Dr. Kannen. We got a lot to get to, and we want to start with the Buccaneers because their injury list is piling up. We'll start with Antoine Winfield Jr., who we know he's got the knee sprain. He's going to be out for a couple weeks. Realistically, what type of time frame are we talking here, and is the sprain, Dr. Kannen, the best case scenario?
Thanks for having me this morning. So with a knee sprain, I'm not sure exactly what type of ligament, but typically with a knee sprain, it's either a stretch or a sprain to one of the ligaments in the knee. Best case scenario, this is an MCL, which is the most common ligament injured. It's on the inside of the knee. It usually happens with a tackle or if they slip or fall or twist their knee. Typically, it takes a few weeks for the knee to heal, and it's really based on its pain tolerance. If there's any swelling in the knee, that can also contribute to any delay. So it can take, usually 1 or 2 weeks, sometimes longer.
When you're dealing with athletes and this kind of injury, I'm curious, do you give them different advice based on the position that they play? If they need more lateral movement at a position, do you maybe hold them out a little bit longer than you would a guy that's basically moving north and south?
Yeah, so if you're more dynamic, if you're moving side to side more, if you're running up the field a lot more, you're probably going to need more time. If you're on the line, generally you can use a brace, but the ones who are running up in the field are more dynamic. They tend to not be able to use a brace.
Dr. Kannen, Derek Carr in the division here with the Bucs, he fractured his non-throwing hand against the Giants. With the hand fractures, how different are they from other hand injuries? And is it a common thing to have a fracture like this?
They're pretty common. It depends on exactly where the fracture is. Certain bones can be a little bit more troublesome compared to other bones. If it's a small crack in the bone, it can cause some swelling. It could cause some lingering pain that can linger for a few weeks. A lot of players can continue to play. It really depends on where the fracture is, how much motion they have in their fingers and their hands, and sometimes you just require some bracing or taping for a few weeks.
Now, when we say fractured hand, that would be the same thing as me saying he has a broken hand, correct?
Yeah, fracture or break are pretty similar. And again, it just depends on kind of where the fracture is and how much he can tolerate. If there's any swelling, that can also limit some motion. Since it is his non-dominant hand, that is good news. So usually they can tape it and see how much pain he's in and if he can keep playing.
Yeah, because when I went to see you guys when I got my finger injury,
oh boy,
she said to me, "You have a fractured finger," and I said, "No, I think it's broken." And she said, "That's the same thing."
Yeah, it's the same term. Some people will just use either one of those terms.
Correct me if I'm wrong, doctor. The way I've heard it explained, and again, this is just secondhand, so I don't know that I'm knowledgeable in any means, but the way I've heard it explained is that a break is usually a very clean break, but with a fracture, you a lot of times have like some splintering where it's not quite as clean of a break. Is that true?
We use a little bit different terms. If there's multiple pieces, we call that comminution. It's just a medical term for multiple pieces.
Wow.
And there's other kind of terms we use if it's a simple break, if it's more complex, if it goes into a joint, that can also be more complex. So really fracture or break, similar, but you can describe it a little bit differently.
Doctor, we know a lot of people as they age develop arthritis in the hands, I think as much as anywhere, right, with the fingers and stuff like that. How much does having broken fingers lead to arthritis later in life? If
the fracture or break goes into the joint and if there's any separation within the joint, that tends to lead to arthritis in about 50% of cases. If it's a clean break, if it doesn't go into the joint, it's probably not going to cause any arthritis. There's other things that can cause arthritis, just age, certain autoimmune diseases. But usually if the fracture doesn't go into the joint, it usually won't cause arthritis.
I still think I'm on my way to the rightus.
You think you're on your way to everything, Aaron?
I'm like close to the rightus. But I had the broken finger too, so makes sense. Bucky Irving, we're trying to figure out what's going on. He's got the back injury, he's got the hip injury. Coach Bowles said it tightened up on him. Let's talk about some of these injuries. Do you think you can compare them, or not compare them, but kind of put them together as one maybe impacting the other and maybe making one worse?
Yeah, back injuries can be very tricky. It depends on his history, if he's had any prior back problems. Usually what they mean by when a back tightens up is you can get some muscle spasm because there's big muscles along the spine that can kind of spasm if he twists or moves a certain way. Other things that can cause it would be like a disc problem. And then there's other types of things like slip disc or slip vertebrae. that can happen as you age. So all those things can contribute to it.
People, I think a lot of times are very reluctant when it comes to back surgery. I've heard, sometimes it can be very hit or miss. What kind of things do you need to see within somebody, within their spine or their back, that tells you that, you know what, and because I know it's always a last resort. A lot of what you guys do is try to keep people away from needing surgery, right? But what do you see that says, you know what, unfortunately, like this is kind of what you need to do?
That's a loaded question. There's a lot of things that kind of play into that. Again, most people don't need surgery. There's things that we look at if there's nerve compression that's causing nerve damage that's not getting better with conservative management, which is typically PT, medicines, ice, heat, rest. If there's weakness that's going on in the extremities, that can lead to nerve damage, and that's something that you would do more surgery for. If there's anything that's being compressed or stenotic, which means narrowing in the spine, that won't get better over time and it can get worse. So that's another reason that potentially could lead to surgery. So there's lots of different things that can contribute to that. Again, majority of people don't need surgery for a back problem. And if you do, then you definitely want to get checked out and make sure that you've had all the right treatments for it.
Well, we always love having our doctors on from Florida Orthopaedic Institute in partnership with Tampa General Hospital. And Dr. Jeffrey Kannen, really appreciate you joining us today. And the Pat and Aaron Show Injury Report presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute, providing you access to one of the top orthopedic programs in the nation. Do not wait today. Schedule an appointment at floridaortho.com. Dr. Kannen, thank you so much.
Thanks for having me.
Thanks, doctor.
Yeah, listen, somebody on the text line, I think that's Ryan. Yeah, I think I'm on early onset itis.
Yeah. By the way,
gonna get
Dr. Kannen is tough, dude. He doesn't just throw around great question like some of these doctors. You know what I mean?
Yeah.
I kept being like,
crack them.
is that the one? Is that the one? No, I don't think I've gotten a great question from him yet.
No, you got to really work hard if you want to get that. And they're working hard over there at Florida Orthopedic Institute in partnership with Tampa General Hospital. You just heard Dr. Kannen, but they have a doctor for whatever your needs are, whatever injury you are dealing with. So don't wait today. Let the highly skilled board-certified physicians and surgeons at Florida Orthopedic Institute help you out.
And the best thing is they understand at Florida Orthopedic Institute that accidents and injuries don't keep regular business hours. So if you need that emergency care, they're there for you with the emergency care as well. It's just what they do. And accessing that world-class orthopedic care, whether it's an emergency or not, it's easy to do. Just call 800-FL-ORTHO or go to floridaortho.com.